Snow White was 1812. How many of you have heard of Sleepy? Snow White. Everybody knows who Sleepy is, right? Well, Sleepy wasn't introduced until 1937. But Sleepy has all of the characteristics that we look for in our patients that aren't sleeping well. First of all, he's overweight. Obesity plays a big part in sleep apnea. In fact, it's the #1 cause of it. And having said that, only 50% of the patients that I treat are obese. The other 50% are not, which is why we screen every single patient that comes through the door. Every patient. Just yesterday, I had she was about a 50-year-old female, thin. I mean, she looked about like you, and her AHI was 54. And those of you that know anything about this, extremely severe sleep apnea. And yet I had an obese male who was probably 300 pounds and about 5'10" right before her, and his AHI was 8. So obesity plays a part, but it certainly doesn't mean you have apnea, and it doesn't mean that thin people don't. So that's why we screen everybody. He's a dwarf, and dwarfism, sleep apnea is much more prevalent in dwarfs. He is edentulous, except for one tooth. And we know that edentulous patients, first of all, they're already a little bit older, but their vertical dimension, when they take the dentures out at night, it decreases, and they are much more likely to have sleep apnea. So those of you that encourage your patients to sleep with their dentures out at night, you're encouraging them not to breathe as well. So keep that in mind. I know what you learned in dental school. I know what we're supposed to be telling them, but take it from me, that's not the right thing to do. And he's sleepy. I mean, that's why he has this name. It's why we give the Epworth Sleepiness Scale to every patient. It's our way of screening for this disorder. He has no nasal airway. I mean, none. Yeah. So we know that in patients who do not respond well to therapy, our therapy, when we provide them an oral appliance, the #1 reason for non-responders is an airway, a nasal airway that's not patent. So we need to improve their nasal airway to get better results in our appliance therapy. He's male. I've always heard that more males are apneic than females, but I just tended to think that there's no way in my practice that was the case, because it just seems like I see a lot of females, and I was thinking probably 50-50 in my practice, like mine is different. But the statistic I keep hearing is 4-to-1 males to females. And I was saying, no way is it 4-to-1 males to females. So I decided to run the statistics on my practice. 3.7-to-1 male to female. Sure enough, I think just maybe the women talk more, and I just remember them more. Certainly they do refer in their husbands, and they're with their husbands to make sure that they get treated when they come in. So I guess I see a lot more females in the practice because they're coming with their husbands. Snores and gasps in the movie. I don't know if you guys remember watching Sleepy, but he does. And then he wears a beard. People wear beards many times to hide retrognathia. If they don't like a small chin, they recover from that by wearing a beard. And retrognathia is something that creates an airway problem for many patients. He also probably has a large neck. In males, the neck size 17 inches or larger is much more likely to have sleep apnea. So if your shirt size is like 17.5 that you buy for comfort, there's a good chance you have sleep apnea. Well, this is what sleep apnea looks like. Now, this guy is on his side. That is not a worst case scenario. Okay? If he's on his back, he's going to be worse. But he would die on his back, so he's forced to sleep on his side. Now, he's drawn some air here, but right here he stops. He's trying to breathe, but there's an obstruction that's not allowing him to. So he finally draws some air because his brain says, move around and do something, get me a breath of air, and then he falls back to sleep and he occludes again. And this happens all night long in these severely apneic patients. You have to stop breathing for 10 seconds to call it an apneic event. And that's about how long he stops. I honestly don't know how somebody lives through the night like this. They manage because the body keeps, the brain keeps the body in a much more awake stage of sleep. In other words, it doesn't allow you to get into deep sleep or REM sleep, specifically deep sleep, the kind of sleep that we really need. That deep sleep doesn't occur because every time you start to get there, the breathing stops and they have to bump back up into a shallower level of sleep. So these patients get no deep sleep. In fact, the severe apneics get zero deep sleep, and we need deep sleep to help us with our memory, to help us lose weight, to help us recover from a sickness or something that happened the day before. It's extremely important to get it. I wanted to put in a few recent patients. My wife listens to my radio show and she says, Kent, you talk about research, and she says, that's really, we want to hear about real life. We want to hear about patients. So I started talking about patients on the radio a few weeks ago, and yeah, I guess she has a point. You do like to hear about patient stories. So I threw in a couple of patients here that I've seen over the last few weeks just for interest. This is Ryan. You see these patients in your practice all the time. Ryan comes in through hygiene, just like a patient might do in your own practice. And Ryan is 34. He had a heart attack at 30. Heart attack at 30. The cardiologist never asked him if he snores or how he sleeps or anything. Didn't ask him. So we said, listen, Ryan, you need to go get a sleep study. Let's find out how you are. And it turned out he had severe sleep apnea. And it still wasn't treated, even though the heart is the #1 organ affected by not breathing well. So our healthcare system is a little bit backwards, and I'm afraid that you're going to be responsible for finding some of these patients in your own practice. I really hope that you do.